In the PEDS department, we really offer 3 different levels of service. We have a pediatric ICU, where very critically ill children are cared for. We have a general unit where kids who are not so sick, but sick enough to need to be in the hospital stay. And then we have a very large outpatient service. We have committed ourselves to making sure that every child who receives care here is cared for in the pediatrics unit. So regardless of if they're just coming for an x-ray, that's going to be a same-day procedure. They come for the preparation and recovery of that to our pediatric unit. So every child we see benefits from the expertise of doctors and nurses who are specially trained in pediatric care. We have 2 full-time pediatric intensivists who are doctors who are specialized in intensive care medicine, and they attend to the children in our PEDS ICU. And then we have a pediatric hospitalist, Dr. Rainwater, who cares for children on our general unit.
Yeah. I'm a pediatrician, just like the pediatrician that sees patients in a clinic, but my whole job is to see children who are hospitalized. It's wonderful for families because there's someone who's available in the hospital really all the time, so that if they have a question or if there's been a change, someone can be right back at the bedside to reassess and decide what needs to happen next. I work very closely with the pediatric intensivists, and we often will work together in caring for a child who has suddenly become quite sick. So it's wonderful that they can go right to the ICU and receive quality intensive care, and then as they improve, come back to the pediatric floor, and they really receive seamless care that way. I think one of the most exciting things at St. Mary's is the way we care for families. Across the nation, there's a real move to involve families in care and to make families feel as comfortable as possible and as involved as possible in everything that's happening to their child when they're in the hospital. I think this is something that St. Mary's does extremely well. Part of that is because of our mission, and part of that is because of the compassion and dedication of our nurses.
100% of our nurses are pediatric trained. We think that's very important because it means that all of the pediatric nurses have a very high level of assessment skill. The need for pediatric care at a level that can respond to how sick kids are who need hospitalization is really driving a lot of our planning. Children have more chronic illnesses, and when they are hospitalized, they are more acutely ill and more complex than they were 10 or 20 years ago. So we are preparing ourselves through the use of intensivists and hospitalists and highly trained nursing staff and respiratory therapists to really respond to the increasing intensity of the patients and also to the growing needs of the community.